ICS class, and my students of the new batch, I will say that they should take their, what's your name?
Dr. Asha.
What's your name?
Dr. Abdul.
Dr. Abdul Wahab. My name is Professor Hussain Muskulachi, and my team has prepared today's topic. Yesterday we were discussing epidemiology, and in epidemiology types of study or study designs were discussed, and we just gave an overview that basically there are two study designs. One is descriptive, in which you just describe the situation, and definitely this is in a medical field, so you are describing the medical problem, health problem, disease. You can take any kind of a disease, whether it is communicable, non-communicable, within communicable disease, whether it is a diarrhea, respiratory infection, or a non-communicable disease, heart attack, obesity, and many other things are there. So, and another is analytical. In analytical, we normally use some kind of comparison, whether case control, whether cohort, or whether any kind of experimental group. We give something to this group. Suppose two painkillers are there. We can compare. We are giving one painkiller to this group, and we are giving another painkiller, and we can compare. So in analytical, basically we are comparing, and in the descriptive, we just describe in terms of time, in terms of place, in terms of person, but we don't have a comparison group, or we are not following them for the long time, or we are not going backward to see their records. So today, as a GP, normally epidemiology and the research start from the case report. Suppose the COVID is an example. It was originated from China, from Wuhan city, from the vet or the animal market, and from that it went to the various countries, and ultimately on 26th February 2029, first case was reported in Karachi. So you understand that how a single case is important, where from it originated, and if you describe this whole scene, then you can understand better, and ultimately the vaccine, the scientific community, the WHO, the entire lockdown, the airports were closed, and even the people, they were sent to the quarantine, wards were open. So from a single case, you can develop an entire series. So we will discuss this, and then more cases, then it becomes a case series. 5, 6, 7, 8. So this is the way how the medical and even the scientific community is analyzing the data, the situation, the condition, and the term is used case report and case series, which is the topic of the today. Next please. Yes, this is basically this is one chart, but if you think that this is a descriptive and this is an analytical, then you can have further series of other, and you can see that there is a case report and there is a case series also. And you can see that the descriptive word is there, and even observational, experimental, analytical, you can see here the word is analytical. In analytical, you are using some kind of comparison, or you are following for a long time, or you are going into a depth of this. So you can see then lastly the meta-analysis. When when many studies are conducted, then one researcher will see all the studies and give you another summary of all the results, and that will be more powerful because 10, 15 studies what they are concluding at the end of the study. Next please. So end of this case study and case series, you will be able to define clearly. I have just given a gist that case series is a first case or the initial case, or sometimes we call it index case, or the first came into the knowledge of the physician or to the health delivery system for our purposes. It can be any paramedics, it can be any consultant who captures that and explain the advantages and disadvantages and differentiate case series with other long studies. In case series, you can have 2 months, 3 month study, but in certain cases you can have 2 years study, 1 year study, 6 months study. So this is a brief period study. Next. So coming to this is another word used in public study. Normally, case study is to study a unit, to study a kind of phenomena or situation around you. But when we say case series, it is basically a clinical case, or a case with certain symptoms, with certain syndrome, or with certain complaints. Yes, next please. Case studies are on the preliminary observations are frequently refuted. So case series is basically an initial observation, and if you see that there are many other things also, and they are not experimental or experiential. You are not giving much experiment or much study or in-depth study in the next case. Case report, this is important, and if you see, it illustrates hypothesis. Have you heard what hypothesis? A scientific guess or scientific assumption. It is basically assumption that this case is from this area, or this disease is from that organism, or that problem has from this family. So this kind of assumption is called, in scientific terms, it is called hypothesis. And thesis means your opinion, your judgment, or your assumption normally. And then prompt and a new hypothesis can also be generated. Treatment failure can also be there, and the correcting method can also be there, and reports iatrogenic reactions. Sometimes you can report a drug or any sudden reaction, hypersensitivity reaction. This kind can also be part of the case series or case report, and you can have some kind of brainstorming or some kind of thinking that what is this new problem. And same was happening with the COVID in our case report. Recently, still this problem is going on, though the vaccine has reduced it, but it is still not 100%. We are not sure how it originated, whether it was from jumping of the virus from the animals to the human beings, or it was already existing and then spread to the population. Next please. is another word used for a case report. You are telling, and normally you take the history of the patient. So that kind of storytelling, is part of the case report. Another is a stimulant for more comprehensive and prospective research. This case stimulates you, encourages you that you can have further study, and that can be the starting point. So this is the importance of a single case, whether it is in Chatta, whether it is in Dandolaya, whether it is in Kashmir. So you can pick a story of that case and you can report, and this is published in the journals for the larger understanding of the medical fraternity or community. Next, please. Then coming to the case series, account of multiple patients of the same problem. Suppose you can have a birth defects in certain villages, 1, 2, 3, 4, 5 houses, or you can have dwarfism is nowadays a big problem. The short statureness is a big problem, and you can understand that generation was taller, and second generation is less taller, and the third generation is more of a short stature. So what are the reasons? And you can compare. And I still remember that one of the researchers traveled from America. He was from Dhaka University, and he was studying at least 11 cases in Sakhara Rodi, because from one family all the members were of a small stature. So he was collecting the blood sample, and he contacted me, and we then contacted the administration. Ultimately, the growth hormone, special growth hormone deficiency was identified there, and that was a case series of 11, 12 people, and that is still one of the good study that what type of growth hormone deficiency is occurring here. So such kind of studies are there, and you can see that what is the meaning of evidence. Study produces some kind of reason, justification, knowledge, opinion, or proof. So why you are conducting this study? And even at the end, what is the examination of MCPS or FCPS? That will be the proof that your knowledge, your experience or understanding of the public health and community medicine. Some people will ask certain questions, and ultimately they will certify or create evidence, what we call degree, diploma, or even any kind of certification. Then coming to, you want to alert other members of the community of this possible association. So the reason of case series is to alert the other members of the society that you should. In the same case, I am repeating the COVID. So how much it was made through the media, but originally it was one case in Wuhan, few cases in that China, and then ultimately a million cases were reported, and lot of investigations and diagnostics. Next, please. So case series once again can be conducted retrospectively or prospectively. So that is the reason that the bigger study is not called case series or case. So you can see backward and you can see forward, and that can be the MCQ for you, that whether case series can be retrospectively, prospectively, or both. So the answer is both. You can go retrospectively backward and you can forward see other cases or wait for the other cases and compile the cases. Next please. Importance of the case series is also there. Creating case definition. Here you will create a complete case health services research establishing safety profile also. You can save, prevent the other people also because you have identified that suppose the use of the mask was considered very important, social distancing was considered a very important tool, and even the isolation of the case is important. And the clinical case series are of value in public health field for studying predictive symptoms, signs and tests. So in public health through the case series you can generate the pool of the symptoms, group of the symptoms, tests as well as signs also. Next please. So this is an overview that how one case is important, how 10 cases are important, and what are its relevance in public health, in your own life, in your own subject of the community medicine. So don't feel that you are few people, just one or two students are coming to this class. Only a single case is important, few cases are important, and the whole understanding and knowledge growth can emerge from this root, and just like a tree it will grow and it will help other people, humanity, community to be saved from difficulties, from life-threatening conditions, and even from the other physical pains and sufferings. So I think with this we conclude this short, and I hope the MCPS students will not be discouraged because we are running this course with a great attention that everybody should learn from multiple sources, whether they are from the digital sources, whether they are from the teacher sources, whether they are from the book sources. And even I recommend this book to my students that you should focus on one book. You can read many books, you will see other things, and also go through the newspapers and daily news channels because at least 2 to 3 public health related issues or diseases or problems are